So could you please tell us more about robotic surgery and how it is aligned with the orthopedic?
Yes. So in orthopedics, robotic surgery we are mostly now using for joint replacements. So if we say we with robot we are doing hip replacements, we are doing total knee replacements, we are doing partial knee replacements and shoulder replacements, spine surgeries. So what it does is, again, we do a CT scan, we know the patient's anatomy, we can plan what is the amount of bone we are going to cut, precisely what angles do we want to correct. Like if a patient is coming with bow legs, we want to correct it to a 180 degree alignment, we can do that very precisely to a 0.5 mm error, and then we can specifically order those implants which are required for that patient. So again, less blood loss, faster recovery, lesser bleeding and lesser pain.
If I say our generation and the young generation, like our father and mother, but the older generation who is not aware of robotic surgery, how you make up their mind to go for this kind of surgeries?
Right. So first of all, I want to clear this myth. Some people think that robotic surgery means the doctor is sitting somewhere having tea and the robot is doing the operation.
Yes.
It's not that. So the robot is assisting the doctor. The surgery is done by the doctor himself. We can take over whenever we want and we can modify the plan as per our needs.
Okay.
So it is not the robot who is doing the surgery. Robot is just guiding us and telling us, so this is the plan, this is 180 degree alignment which you are trying to do, this is what you have to cut. If we think no, the robot is, we can do a little bit better for the patient, then we can do that. We can overturn the decision made by the robot and we can take over. So it's the robot is assisting the doctor. The robot is there, it is assisting and it's the doctor is always there. So this is number one myth. Number two is robotics is more important and beneficial for those complex cases. Suppose a patient has a rod inside his thigh bone because of a previous surgery.
Yeah.
Now you cannot do a conventional, that is a routine joint replacement, because you have to put some rods inside the bone to perform that surgery. In those cases, robotic surgeries are very good.
Okay. So the recovery period after robotic surgery and the normal traditional method are same?
So we have done a lot of studies and it is shown that in early post-operative time, that is for 6 to 8 weeks after the surgery, robotic surgery is claiming to give a faster recovery compared to conventional. But if you see in the long run, say 3 years, 5 years, 10 years down the line, then the functional outcomes are same.
Okay. So basically the recovery is faster, but the outcome is same.